Welcome, everyone. We're going to get started in just a moment. See, folks are coming in from their last meeting, so I'll give you one more second. Well, you can all see the screen and hear all right. If not, please let us know in the chat function. All right. Well, we'll go ahead and get started to give our presenters adequate time to share their story. Welcome everyone to our session today. My name is Rebecca Acabas. I serve as director on our Member Insights team here at the Academy, and I'm pleased to welcome you to our Academy session today, the Academy briefing, Leading Out of Crisis, Charting the Future with Employee Voice. Today, I'm excited to have several dynamic presenters joining us who I'll turn it over to in just a moment. But before I do, let me briefly just set the stage for the context of our event today. One message we've heard loud and clear across the last year from you and your peers is concern for your workforce and wanting to identify solutions and ways to support them, not only through the crisis, but coming out of it on the other side. And at this time, when things are starting to feel like they're returning to a sense of normalcy or what will be new normal, it's a moment of opportunity to imagine the workforce and the culture that will take your organization into the future. Many of you have shared plans for hybrid or flexible work arrangements rolling out across the next few months. And for most, these are new and somewhat experimental arrangements. So keeping a real-time pulse on the workforce and finding new and different ways to connect with employees will be critical to building a sense of community and maintaining a highly engaged workforce in our new world of work. In today's session, we'll hear from leaders at Waggle and BJC HealthCare on how they're leveraging active listening to build a stronger and more capable workforce. So lastly, before I turn it over to our presenter, it's just a couple of housekeeping items for you all. All the lines have been placed on mute, but we absolutely want to hear from you. And so we encourage you to ask questions, include comments in the chat function today. Since we are a big group, I will be monitoring throughout. So please don't be shy. And we want to hear your stories and your comments. And Russell will be asking us some questions as well. So please engage. And finally, we will be recording today's session with a link to related materials in follow-up, and we'll also be sharing the slides. So if you have any follow-up, we will look out for that in the next 24 hours. Without further ado, I just want to introduce our first speaker, Adam Tanner. Adam is co-founder of Waggle, which you'll learn more about in just a moment. He has over a decade of experience as a SaaS pioneer building HR technology products, and we're very happy to have him today. So Adam, please go ahead and take it away.
Thank you, Rebecca. Hello, everyone. Thank you to the Academy for having us. My name is Adam Tanner. I'm one of the co-founders of Waggle. For those of you who are not familiar, Waggle is an employee voice platform, and our mission is to give every caregiver, every employee, a voice to make their workplace better. I won't take the time to give you the full download, right here, but I will answer the question I'm sure is on everyone's mind, which is what's with the name? And so Waggle, spelled with an E, takes its name from the dance that honeybees do to communicate within a hive. A hive has 50 to 80,000 bees, and when we need to find a new source of food or a new location, we send the worker bees across the countryside to identify what are the best options for the hive. And very quickly, the bees crowdsource, they coalesce around the options they think are best by doing a dance, which is very similar to the diagram you're seeing on the right of the screen. We love the analogy for how, the wisdom is in the system. The best ideas often do come from the front lines, and the idea of collaboration and even dancing in the workplace, all things that we think, should be true in our human systems as well. So we love the analogy for how modern healthcare systems need to think about employee feedback. And Russell, if you hit the next slide, what we'd like to do is reimagine the experience as a little faster, more frequent, and frictionless in terms of how that feels to the employee. So moving from something that's a little more comprehensive to surveys that are much more focused on specific topics, shorter in nature, from annual or biannual surveys to much more flexible feedback when and where we need it. The results, in a lot of cases, taking months or weeks at least to tabulate and collect. Can we move that to real time? And then probably most importantly, as it relates to action, what are the actions we're able to take when we do go through the efforts of listening to our people? And in so many cases, moving from something that's a little more HR driven to how do we really go from me to we and allow the managers and the employees to lead the action locally and on their teams. So this, if you go to the next slide one more time, Russell, this really gets back to why we exist. In order to give every worker a voice and making their workplace better, we also need to empower providers to translate this feedback, not just to action, but into the right actions. And I think that's what we're going to hear Russell and Jackie talk about a little bit today. With that, I'd like to introduce you to Russell Hoffmann. He's one of our partners at BJC HealthCare. Russell's the Vice President of Culture and Organizational Development at BJC. And Russell and Jackie will be sharing their journey of utilizing employee voice in leading through and emerging out of these unprecedented times. So with that, Russell, please take it away.
Adam, thank you. Thank you for the warm welcome to the Academy and also to the audience. Thank you for allowing us this time to share our story and share our journey with you. I'll be introducing Jackie in just a moment. I want to put some context, though, to today's presentation. So I can only imagine how many of you had on your contingency shelf, you know, how you solve for, let's see, a pandemic, ongoing social injustice challenges, financial crises, mental health crises, and a few other things, right? I'm sure every hospital system planned for those simultaneously stacking. So just like you, we too have found this past 15 months some of the most challenging leadership moments. And during this, what we'd like to share is how we've led, especially over the last 6 months, through the decrescendo of at least aspects of the crisis and working towards leading forward. In doing so by using the employee voice. What we hope is that minimally you leave here going, all right, their approach and our approach, at least we're on the same boat and going in the same direction. And there's some comfort in that. Ideally, you have a few ideas that you can take away. And what we will be asking is for you to share your experience with us. And in particular, at the end today, we are going to actually leverage the Waggle platform and crowdsource together what we collectively think might be some good tactics to use to get out of this post-pandemic period of time. And because at the end of the day, our work in healthcare, we are not in competition with one another. We are here to care for and serve our employees so that they can best care for and serve our patients and communities. So working together at this point in time, it seems helpful and healthy for all involved. So before I introduce Jackie, I want to put context. You'll hear a little bit more about who BJC is and who Jackie and I are in just a few moments, but we wanted to get into kind of our journey. And in particular, we're going to bring you into right around January of this past year. So in that spirit, you're seeing this plane wing and in a fog. Think of it as an analogy of flying a large plane through thick fog, because one could argue that folks on this call have been pilots or co-pilots leading their workforce in their patient population through a really difficult to navigate time. And so I'm going to turn it over to Jackie here. Now, this is a novel moment for, frankly, our delivery. Jackie and I planned co-delivery, and we are going to co-deliver. But she's going to deliver through a pre-recorded, because actually, is just like everyone out in our audience, we too remain dynamic at this time. And some of you will appreciate, we have just publicly announced that we are mandating the COVID vaccine and that all of our workforce will need to take that. And that's creating wanted to make sure that Jackie was available to our leaders to be able to be responsive to those questions, since that news is 24 hours old, and we have a leadership meeting planned at simultaneous time here. So with that in mind, I want to introduce our Chief People Officer and my boss. Her name is Jackie Tischler, and she'll join us for this segment as well as some other segments.
Hello, I'm Jackie Tischler, Chief People Officer for BJC HealthCare. I'm virtually present in 2 ways today. Once, this is a virtual presentation, and the second is that I'm being recorded. I was so excited to join today's session to share our experience with you and learn from you. But unfortunately, as these jobs go, an executive demand came up last week, and as all of you know, we are first responsible to serve our organization as well as our CEO. So I'll share a few perspectives with you today to frame up our update, and then Russell will share with you our experience and learnings. Russell has also promised to bring me back the collective wisdom from this group. So I'll start by taking you back about 6 months ago, January 2021. Just like you, we've been inundated with our COVID crisis since March of 2020. By the fall of 2020, here are a few of the highlights of things we had experienced. We'd already lived through the first 2 COVID surges, during which time we had transformed patient care units and practices to consistently care for patients with COVID. We'd established new ways of supporting clinical staffing, especially our nursing and nursing support teams. Though staffing has really been fragile since day one, as we entered the pandemic in a staffing deficit for nursing. We'd returned to work nearly 4,000 employees that we furloughed, and we eliminated a modest number of roles by the fall. Regarding PPE, thankfully, due to our experts in supply chain, our PPE supply was fairly stable. However, we were wrestling with the PPE fatigue and starting to see an uptick in COVID outbreaks among our staff. We had 9 months of nearly 5,000 of our workforce working remotely, and after the initial disruption, we were into a better rhythm. Financially, we were seeing promise regarding outpatient and surgical volumes returning into the fall. And then beyond the impact of COVID, we also faced the realities of social injustice that were facing our nation as well as our region. The emerging conflict within our nation relative to political discord and how that was showing up even within the workplace was a concern. And many of the same burnout and mental health challenges we've all seen were concerns. Now let's look back at where we were as of January 2021. We were starting to face the 3rd surge of COVID and by far the highest number of patients we'd experienced, and this was placing us beyond the brink of bed capacity. Hospitals had become highly creative to find as many places to safely put a patient as possible. Our staffing crisis, especially for nursing, was of top concern. It seemed we were only meeting the demand by paying exorbitant rates for travelers and then facing the frustration of existing staff for the great discrepancy in pay. The resilience of our workforce had been an area of focus prior to COVID, and our concerns were just rising and rising, given the multiple demands facing our caregivers, both inside and certainly outside of work. Burnout and mental health concerns were mounting. And while the promise offered by the vaccine, man, it certainly provided hope, it just couldn't happen fast enough to really make an impact on the immediate crisis we faced in our reality. Now, politically, St. Louis is a blue or maybe purple dot in an otherwise red state, and the political turmoil was intense at a time when stability was most needed. By the way, did I tell you when I became the Chief People Officer for BJC HealthCare? Well, that is April 2020, right at the start of COVID. And that made for an interesting first 90 days. It has been quite a journey for all of us. I am not sure I'd recommend starting a Chief People Officer role at the beginning of a pandemic, but I've certainly learned a lot from the experience. And in many ways, it was a benefit for a new leader. Everything we faced was uncharted territory. No one has a playbook for their first pandemic 90 days reading. So I think you can see, or at least will see, a picture of flying a plane through dense clouds as image for this introduction. Well, since the spring of 2020, it's been like flying a very large jumbo jet with nearly 30,000 employees, our passengers, through a thick fog. The fog is the uncertainty produced by the pandemic and all the other challenges facing us. As a Chief People Officer, a primary responsibility is to be attuned to and attend to the experience, engagement, and well-being of our workforce. Not to mention that every month past seemed like a lifetime. Everything was moving so quickly. Just as you got your feet under you with a sense of where to focus, everything would change. So as we moved through the crisis, I knew that we had to solve for creating better and faster visibility into our employees' experience. As we got into late summer and early fall, I asked Russell to help me appreciate our people data. Specifically, it's our dashboard of instruments, if you will, that could help me understand our historical workforce experience, engagement, and well-being. Russell's going to share with you what he shared with me at that time.
All right, so this is what I shared with Jackie. Well, our last employee engagement survey would have been in the spring of 2019. So by the summer, fall, that data is 15 to 18 months old, not as particularly relevant. So that wasn't great news to share. Then the second not so great news to share was we were planning on doing an engagement survey in the spring, and just before Jackie arrived, we decided not to do that in light of the demands of COVID. Third is that we have a history of using a very robust, I'm sure many of you are familiar with it, 50, 60 items, very comprehensive, and that we had decided that probably wasn't going to be our plan going forward, but that we didn't have necessarily a solution. We had looked at solutions, including Waggle, but we hadn't landed on a solution. So at this point in time, what Jackie heard was, you're flying this jumbo jet with 30,000 people with an instrument panel that kind of looks like the one that you can see on screen here. By the way, Jackie's background before entering HR, she was an accounting professional. So she loves her data. And so that was the news that I had to deliver to her. Let's hear her reaction.
So you just heard what Russell shared with me. I learned that as the new Chief People Officer, I'm flying this jumbo jet with our 30,000 caregivers on board who are desperately needed to care for our community, and I have an antiquated instrument panel to understand how our workforce is doing. It was not an option to shoehorn in our historical survey during the crisis. It was too long and no longer as relevant. We could have pulled together a survey, but that would have been reactive, and the administration of it would have required either renewal with our historical vendor or generating an easy to administer yet very difficult to interpret survey without it being structured using our feed from our ERP, which is PeopleSoft. In the absence of this information, it's hard to appreciate where to focus our efforts and resources in this emergency. Everything became an anecdotal tale, and I couldn't gauge if problems were real or just amplified because of the stress. It was hard to know if it was a big problem or a little problem. Resources were already stretched, so we didn't have the luxury of missing the mark. Fortunately, we had highly engaged leaders who helped to navigate through this time. We listened to them and determined to the best of our ability where we needed to focus on caregiver well-being. In summary, I think we did okay, and that was due to many of our leaders going above and beyond to appreciate where we needed to focus our support. Russell and I were certain, though, this is not a desirable state, and we needed a better solution going forward. I recognize that I was new to my role as of the spring of 2020, and certainly that added a layer of complexity on how to best serve my healthcare system. I imagine, though, even if I had been here prior to COVID, I would have still found the experience daunting. Our organizations were looking to all of us to safely fly these jumbo jets through these adverse and uncertain conditions for months on end. I'm curious, did any of you experience as I did? This is one of the more challenging times to serve as the people leader for your organization. As you think about your response, I'm going to hand you back to my colleague, Russell, who will take a few moments to hear from you about your experience.
All right.
Russell,
yes.
Before you jump back in, just one note, we do see, just a reminder, there you go. If you could just, exit your email might give us, we're lots of technology here today, so appreciate everybody coming along the ride with us.
Great, thank you. Thank you, Rebecca. All right, so you heard Jackie, and we're curious. Is this phenomena that we experienced unique to something about the Midwest and St. Louis and that we're an anomaly? Or alternatively, we'd love to hear from you by capturing either a phrase or a word or a description, what it was like for you to lead during this time. So if you could, in the chat function, if you could open up and just enter a word or a couple of words, a phrase to describe your experience of leading during this time. And Rebecca is going to be is going to comment on those as you enter. So thank you for doing so.
Inspired. Innovation, quick pivots, so all things you've alluded to. Agile.
Excellent.
Fluidity.
Excellent.
Yeah, so some themes there with that flexibility, certainly things we've heard for sure. Resilient.
I wonder if anyone felt a little overwhelmed. Clearly, again, this was a time when we didn't necessarily have a playbook and having to deal with a lot of ambiguity. So in that spirit, hopefully you can, while you may not have been new as of April 2020 in your role, the general spirit, I think, was what we experienced here in St. Louis was probably replicated in other areas. So before we tell the rest of the story about what actions we've taken, I want to take a few moments to talk about who we are, just to re-anchor, because we don't want to make assumptions about the audience knowing who BJC HealthCare is. And so with that in mind, very quickly, Jackie shared a little bit about herself. Jackie came to us a year ago. She came from Baylor Scott & White, where she served as a senior vice president for HR. Prior to that, Jackie had worked as an HR executive in a couple of other healthcare systems. And as I mentioned, her background is accounting, and she loves her numbers to help her play to her strengths in making smart decisions. For me, my background is actually a clinical psychologist. I joined one of our hospitals 25 years ago, and I've had the opportunity to grow my career here, both as a clinician, then as a clinical operations leader for about a decade, and then as my passions grew for more leadership and organizational development, I was able to grow my career within BJC. So who's BJC? Well, a couple of things stand out. One, we are in the heart of the Midwest. So we are in the Missouri and Illinois area. If you drew a 90-mile radius, you would find our 14 hospitals and health service organizations. So that is our geographic footprint. We are the largest employer in our state, in the state of Missouri, and definitely in our region. We are a $5.5 billion organization per year in revenue. And from the standpoint of where we're at in process, we were historically a holding company, more of a holding company model, and we are moving towards an integrated academic healthcare delivery system. And we're early in that journey over the last few years, although COVID certainly has accelerated that, gave us an opportunity to accelerate. A little bit about our workforce, about 30,000 employees, sizable number who are nurses. A couple of other things, about 80% are female. With regards to tenure, we have a bimodal distribution. We have a number of folks who are early in your career, early in their tenure with our organization, and then we have a sizable group who are 10 years plus. As you can see, the vast majority of our employees fall within nursing, clinical, and support roles. And then, of course, across the generations, we have a pretty healthy spread with a sizable group in the Gen Y, or millennial group. A little bit about our academic partner. So our academic partner is Washington University School of Medicine. Washington University has a long and strong history of an academic medical research center. It has several specialties that are rated in the top 10 for the latest US News and World Report. Our two academic hospitals for pediatrics is St. Louis Children's Hospital and then Barnes Jewish Hospital on our adult side. So they are our partners in this work. And while our two entities are technically separate, we are highly integrated. A little bit more about our story, and I anticipate many of you will relate to it with regards to data. So we historically used our employee engagement survey, and then we had a parallel process for our safety culture survey using the ARC's safety culture survey tool. And the bottom line is this, either on an annual basis or every other year, we would distribute the 50 to 60 items, a robust questionnaire. We'd get back the feedback. We'd have some analytics work to do, and then we'd have a cascading through our executive levels. And then it would get to our front line and we'd share data. And then we'd ask them, so what do we make of this data? And usually in the time frame of at maybe the front line or at the hospital, we're getting to true action planning or implementation of action planning, say 3 months, maybe on the outskirts, 2 months after we received our data, and sometimes even longer than that. And while we had a relatively efficient process, we still, the cycle time from listening to action was best measured in months as opposed to days. And then subsequently, that cycle time of measuring engagement on an annual or even every other year basis. The challenge is whatever interventions we put in place, we weren't sure if they were having an impact. And so we know we needed a change. One other factor that contributed to why we were looking for a different solution is, as I mentioned, our healthcare system has focused in on becoming an integrated academic healthcare delivery system. And so we put in place a foundation of values. You see them here. We wanted to be able to measure the maturation of our values as well. And so that was one of the other factors driving why we're in the market to consider an alternative approach, an alternative methodology for listening to our employees. And so in that spirit, we're going to go back to Jackie, hearing from Jackie, because as she arrived, she had some ideas about what her vision was with regards to how we shape the experience of our employees with them as partners. And so we'll hear from her in a moment. And what was great is she was very welcoming to bring me in and co-creating that future state vision. So let's hear from her.
So prior to BJC, I was the Senior Vice President of HR at Baylor Scott & White Health. There too, we had a traditional survey methodology. Just prior to leaving BSWH, we were in the process of exploring how we could better understand the experience of our employees and better partner with them as we try to create an even better place to work. During my transition to BJC, after getting some footing on our COVID crisis, Russell and I talked about a future state vision. For me, I wanted to not only become excellent at listening to our employees, but I also wanted to find an approach where we could even better co-create our future employee experience with our employees. So we agreed that we needed a shorter, more frequent, and easily actionable survey approach, where we could measure the time between survey to action in days, not weeks or months. A survey platform where we could generate pulse surveys that were responsive to the issues that were emerging and that would allow for employees to participate in the solutioning. A survey platform that promoted transparency of findings out of respect for our employees as partners in creating a better place to work. As both Russell and I had recently assessed survey vendors, we mutually agreed that one vendor, Waggle, had a platform that was best aligned with our needs. Specifically, Waggle offered the ability to crowdsource solutions by asking employees not only for their suggestions for making improvements, but also to have them vote on each other's suggestions so that the ideas that resonate with the most employees would rise to the top. Furthermore, Waggle's philosophy focuses on transparency, making data available to all participants and not relying on leaders alone to manage what's shared. Their methodology promotes accountability through a follow-up survey process, asking participants about the extent to which data has been shared and action plans are in place. No more relying on leaders to tell us if they've done an action plan. We now could go straight to the source, their team. Lastly, as we discussed with them that we wanted a partner invested in advancing healthcare, the leadership team from Waggle expressed a similar desire. Further, they were open to the idea of forming an affinity group or consortium that was healthcare specific to make advances in partnership with other healthcare systems. Last fall, just prior to the start of the third surge, we conducted a test survey using the Waggle platform to assess the extent to which the platform met our needs. That not only helped us feel confident about the decision, but it also helped considerably with our change management, as hundreds of participants in the survey then provided feedback on the utility of the survey platform. We found strong support and agreed that Waggle would be our new survey vendor. Russell's going to share with you a bit more about why we chose Waggle, not only as our employee listening platform, but also as our employee listening partner.
So just make a quick summary here. We are aligned philosophically with Waggle with regards to not only hearing our employees' voice, but really about co-creating as partners our future state. The second is Waggle offered a unique platform of being able to crowdsource. So you're going to experience that at the end today, where you not only get to share your ideas, but you get to see the ideas of others, rate those, and collectively we prioritize what we think are the best bets. And so that methodology of co-creation was really attractive. The third part is Jackie had shared. One of our asks was not just to have a good survey platform, but to really have someone, a partner who was invested in advancing the experience within healthcare for our employees. And Waggle's done just that. Actually, just a handful of weeks ago, we had our first meeting of nearly 50 healthcare systems who have all come together to focus on contemporary issues related to leading and supporting the employee experience in healthcare and tackling issues like employee well-being and diversity, equity, and inclusion. So those are a couple of the reasons why we went forward with Waggle. Now, we're going to go back to the story where we left off. And now we're going to talk about, so what actions have we taken in order to partner with our employees in order to lead out of this time of crisis? So as of the winter, we had selected Waggle as our partner. And the next biggest challenge, going through the data architecture, that part was just mechanics. But our most significant challenge was when to advance a survey. We were in our third surge. We knew that making requests for employees at that point in time was operationally insensitive. But what we did pursue was, as the surge was anticipated to wind down, that would be our opportunity to ask. Now, what was fascinating is we had a minority, but a fair number of operational leaders who said, no, we shouldn't ask now our employees about their experience because we're going to hear that potentially it's unfavorable. And so let's wait until maybe things are better. And fortunately, while that concern was valid, the reality is we were first charged with being in service to and support of our teams. And wherever they were, whether they were thriving, disengaged, burned out, we needed to know that information to make informed decisions. So with that in mind, on March 30th, for a 2-week window, we opened our survey. And what we asked were questions in really 4 categories. One was our first qualitative, that crowdsourcing question, which you see at the top here. What's one thing that makes our organization a great place to work? And we heard from our employees, and we'll share that information in a bit. As you can see in the quantitative items, we asked questions there. We could benchmark ourselves against other healthcare organizations as well as organizations outside. The 2 engagement questions we'll take a deep dive into because those were incredibly informative and really shaped how we're leading forward. And lastly, as I mentioned, we have 5 dimensions to our BJC values, and we wanted to get some baseline data to what extent those values are brought to life. So here's what we learned. We had about 66% participation rate. That was 10 to 15% lower than typical, but given the circumstances, we were really pleased with the data. The 66% favorable was really a summary score for today's purpose that's less relevant. What I want to call out is in that crowdsourcing question, here's what we heard. Our team collectively, our 30,000 employees or 20,000-ish, the 2/3 that participated, said first and foremost that what makes BJC a great place to work is the excellent care that we provide, that as a not-for-profit and the region's largest healthcare provider, that they're proud of the resources that we provide to our community and the care that we give. And then third is the nature of working with caring people who share a similar value of being in service. These very qualities are what we see as strengths of the organization, and we want to make sure that we leverage those going forward as part of our brand identity and our team, what resonates with our team. Now, as you can see from
sorry, before you move forward, just You see your notification pop up. So just you might want to click dismiss all.
Oh, thank you.
No problem.
On a different screen. Thanks.
I know you're navigating a lot there.
Thank you. As you can see, strengths. We see our teams working well together, creating a sense of belonging, and the respect and value of talent, having talented team members. We also see from an opportunity standpoint that, as I mentioned, we just pre-COVID, like weeks before pre-COVID, we shared those values that I just referenced with our leadership team. And so our frontline team members were just getting familiar with those. Safe to speak up is always a challenge within healthcare. And for us, we know we have opportunities there. And this last one about work not being energized, this was new for us. And so let's take a look at what we learned further. As you can see here on the 2 engagement items, enthusiastic about working for the organization and that work energizes me, that when our data is compared to other healthcare benchmarks, pre-COVID data, that's important here, pre-COVID benchmarks, what we found is for all of our employees, we were a bit low, but especially for our nurses, we were significantly low. What that told us right out of the gates is that while even though we're coming out of this period of time that's been demanding, that our workforce is incredibly taxed. And this data was sobering for us. And while we saw a lot of positives, this in particular really shaped our path going forward. In particular, what we saw was even at day 3, so of the 14 days the survey was underway, at day 3, because of the availability of real-time data, we could see these trends emerging. And these trends were, again, certainly concerning. And while the feedback was we're running the hospital operations and the healthcare system operations well, from our employees' voice, people were taxed. And so we're going to spend the remainder of our time talking really about how we're addressing this very issue. But before we get there, I do want to hear from the audience. In the chat function, if you could just enter, again, maybe this is a unique experience that we're having, but if you could take into consideration your bedside, your clinical staff, and whether they are bedside or in outpatient operations, but think about how full or empty their gas tank is. This is their reserves, their energy. And if you could just type in, it could be a range, so 25 to 50% or a specific number, and go ahead and enter that in just to get a sense of, is this a unique experience we had or is this a shared experience? And Rebecca, if you could share the results.
Sure. I see half a tank here running on empty, half, certainly not above half. Yep, empty. Yeah. Some red flags for sure.
Yeah, so in that spirit, we knew that while at the beginning of 2021, we were hoping we're going to come out of the pandemic and other demands, and we're going to get back to operations. We set our key performance indicators, our goals for the year, and improving our patient experience, improving our financial performance, our safety and quality, all of those objectives that you do each and every year. This was a moment that as our executive team appreciated the state of our workforce, what we agreed to was before we could get to really restoring the strides that we were having pre-pandemic in those improvement areas, we first need to focus on restoring the well-being of our team members, and specifically then reconnecting and re-engaging with them and re-inspiring them of why those advances in quality and safety and patient experience matter. So as everyone on this call knows, if your workforce isn't there, you can't achieve those other outcomes with regards to patient and business health. So here's what we did. We first focused on restoring well-being. With that in mind, as this team, the folks on the call probably are well aware of, the impact to the mental health of our staff. There's ample evidence in data at this point to say that the prevalence rates of PTSD, anxiety, depression are much more pronounced. And we knew that we needed to be intentional about taking those issues on. And so we focused in 4 areas. The first was to get our leaders, check in on our leaders and make sure that they are supported. The second is prepare them to support our teams. The third is to make sure that we have resources available to our 30,000 caregivers, not just from their leaders, but also directly to them. And the fourth one is identify those areas that are particularly distressed, units, departments that are particularly distressed, and provide some additional support. So for our leaders, here's what we did. There's a good body of research that shows that in the middle of a crisis, you don't do a lot of reflective thinking. But when we look at positive coping, what really influences positive coping is the opportunity to reflect on a distressing experience, organize, frankly, your personal story of what happened and how that experience positively shapes your life. So everyone on this, on today's session knows that you've been through a tough time, and after that tough time, you may come out of it, reflect on it, and you're wiser, smarter, humbled by, more mature. But the bottom line is you gain something from even a challenging experience. So this is exactly what we did with our leaders. We had leaders walk through a reflective exercise of asking questions. The leader, starting with our CEO, met with his next level leadership team, and they shared their experiences with one another. So for example, you can see the question here, describe a moment that you considered a real challenge, something that required you to take action or make a courageous decision. And what did you learn about yourself through the moment? And what did you learn about leading through a challenge? This is just one of several questions that the team went through, shared with one another. The coolest thing was watching the vulnerability and reconnection with those experiences and shared learning and support for one another. So that was one particular tactic that we took to shore up our leaders. Second is we wanted to prepare our leaders to make sure that they can support our team members. How did we do that? One was, you see the just-in-time empathy training. What we know is that when people are distressed, having a supportive, empathic ear to listen to their experience and demonstrate care and concern, that was critical. We wanted to make sure our leaders were well prepared to do that. And then also make sure that we had resources available. So our Thrive program focuses on promotion of emotional, social, and financial health. We have multi-years, a really nice program around building resilience. And of course, we have an EAP program. We want to make sure our leaders were fully versed in the resources to share with their teams as well as themselves. Third thing that we did was that we're doing is providing direct support to all of our caregivers. So this is an opt-in, 2 options that they have there. One is providing listening and support sessions. So this is where team members can call in, they can share their experiences over the past 15 months. They can hear from others, because we know that normalizing distressing experiences is oftentimes a part of the important healing process. And of course, during those, we wanted to make sure that team members were aware of the access to the resources that I just mentioned before, including mental health care. And for those who are less involved in expressing verbally their experience, we provided a journal. And the journal also asked those reflective questions, because again, the evidence, mental health research, resources and research demonstrates that ability of establishing positive coping through reflecting on and shaping a positive story is an important part of regaining health. And for anyone who's interested in learning more about that, that journal is publicly available on one of our public facing websites. Last thing I want to talk about.
Russell,
yes.
Sorry, just one more thing. Russell, for Rebecca here. Could you just exit out one more time for us? I think that should.
Thank you, Rebecca.
Thank you.
That's on an alternative screen, so I'm not catching it. Thank you. The fourth area of intervention is from our survey data. And if you remember those 2 engagement questions, we're in the process of looking at those departments that are notably low. and seeing those as our higher risk for burnout. And subsequently leveraging a brief survey that Waggle has developed in partnership with some other healthcare systems, specifically focusing on well-being, or the inverse being burnout. And it's a series of questions to really understand where are there opportunities, where is the support needed. You can see the 7 questions here. These are for frontline caregivers. And then there's a parallel survey for leaders, and I've just highlighted one of the questions, the open-ended question for leaders, which you can see here is, what is most important? What's the most important resource we can provide you that would make a significant impact on your ability to effectively support your team today? So this is that crowdsourcing question. So we're going to hear from those leaders, what do you need from us? And then they're going to share their ideas. They're going to vote on what they see as the top resources. So as an administrator who's in a servant leadership model, we're listening to, we're not making guesses at, we're listening to what does our teams and our leaders need from us. I mentioned that as we focus on restoring well-being, we then transition into reconnecting and re-engaging our team members. We're doing that through a series of what's called our BJC Leadership Excellence Series. It's for all leaders. It is standardizing the way of leading in BJC. We had planned this pre-COVID, but it's become even more critical now because it's really about bringing our values to life. And our first focus is on, for example, it launches tomorrow. And our first focus is on that for our value of compassion, that leaders have the responsibility to connect with others. And we go through what's the leader standard work and practices that we do on a daily basis, a weekly basis, to connect with our team members as well as our patients. And this becomes our way of standardizing in a high reliability manner how we connect with those who matter most, our employees as well as our patients. Next month, we focus on enhancing a sense of belonging. The month after that, we focus on safety, both physical safety as well as that safe to speak or psychological safety. And what are the leadership behaviors that are practiced on a routine basis that allow us, again, to reconnect and re-engage our team members so that they are best positioned to care for our patients and community. As we wind down today, I just want a few comments. Wow, we're learning a ton. I think probably the most critical takeaway at this point is we wrestled with when do we ask how our employees are doing, and what we clearly learned was ask whenever you can. And I'm so thankful that we asked in the spring how our employees were. It has shaped how we're managing the rest of the year and specifically coming out of this crisis by making sure that we didn't jump just back into operations, because there's no way we could have achieved our objectives without having supported and continuing to care even more intensively for our workforce. So this is where listening has paid off. We are co-creating solutions, as I mentioned, with leaders of what do you need from us and how do we solve this together, and the same for our employees. I want to, given we have a few moments left, my last comment here is, and then we're going to hear from Jackie as we wind up, where we're going next. One, safety culture survey. As folks on the call today appreciate that the Joint Commission requires that. And we are working in partnership with Waggle and a few other healthcare systems to develop a safety culture survey that is not only captures the quantitative information, but again, leverages the crowdsourcing to know how we can create a safer work environment for both our patients and our employees. We're doing the same thing with DE&I, and we're even leveraging this tool as we have an anticipated retirement of an executive. We're going to ask our employees, what do they see are the qualities and characteristics that are most needed for a successful executive in the future. So the tool itself offers us an opportunity to, again, not only listen to, but partner with our teams in creating solutions. I'm going to transition to Jackie now as she wraps up today.
You've now heard our story of how we are leading out of this period of crisis and on to the next chapter of what has to be the most dynamic period of leadership in my career. And I would guess the same is true for many of you. I hope that you found our approach of interest, and after leaving here, we either confirmed a few ideas that you already had, or maybe even sparked a few new ones. I look forward to hearing about your insights and experiences from Russell, as well as watching today's recorded session. Thank you again for allowing us this opportunity to share and grow together.
All right, on that note, I'm going to transition it back to Rebecca, but here's your opportunity. We would love to hear from you. And you're going to see a link in the chat as well as in a subsequent email, a link to a survey. And it's what's one action that you perceive will be most helpful in advancing your post-pandemic recovery efforts. So you too will have the opportunity to enter your thoughts. And then as you see other people what they enter, you get to actually vote on it and kind of rate collectively. That'll help us all learn together on how we can support our teams. On that note, thanks again for this opportunity. Rebecca, I'm going to move out of presentation mode and turn it over to you.
Terrific. Thank you so much, Russell. Definitely want to bring Adam back here to the conversation as well. And as you all look at that link in the chat and start to enter your responses, you can take a look. But in the meantime, please also think about and add in the chat any questions or pop off of mute and feel free to jump in with any questions you have for either Russell or Adam at this time. I'm going to go ahead and actually get us started here. Russell, I'm wondering if you can talk a little bit more. I know you touched on this about some of the change management from the top all the way down to the front line in terms of expectation setting when you're shifting from this annual kind of big lead up to an engagement survey to kind of monitoring ongoing and really what any initial pushback was or what got folks excited about it and how you navigated that.
Sure, thanks, Rebecca. What I'll say is because we had 50 to 60 items in this highly robust analysis in the past, our teams, part of that change management was, we need to be looking at this from 50 different angles. It's like, no, actually, we're going to ask questions over time. And so use the data that's right in front of you and just work with your teams on what's one step forward. And then we'll ask them again in a handful of months. What else can we do? So again, helping our team members appreciate that they don't need to get lost in this sea of analysis and frankly get paralyzed by that and wait for the system to tell them what to do. They get their data from their people and their people are telling them, here's what we need that will make our experience even better, and just take action on that. And it went from a little bit more of it hadn't been a problem as much as a mindset shift, is that we're not being told, here's the system plan, and instead we generate it at the local level.
Super helpful. And Adam, from your perspective, I know one of the potential concerns folks have when moving to this more ongoing survey methodology is, this survey fatigue, right? And so wondering if you could speak a little bit to kind of your approach there and what that looks like.
Something we have to be thoughtful about. And certainly I think one of the key things that we often see is the transition from, we've been doing this 60, 80 question survey once every 2 years to we want to work up to this new approach. And it's not a light switch. We have to build the muscle a little bit, prepare the organization, some of the behavior change. But I think as Russell is saying, when we can break it down to small incremental actions and steps forward, what we find is actually a relief and seen as very easy for most of the leaders, maybe even easier than some of the processes they were trying to manage previously. The other thing we like to say is that people don't often have survey fatigue, it's more lack of action fatigue. So the more we can connect, we heard you, we're doing something about it, and now we're going to ask again, people don't seem to have a problem with that.
I love that switch of the framing. That is true. The action piece can be the tricky part. Russell, just out of curiosity, if you could share, and I'm putting you on the spot here a little bit, one maybe insight or something interesting that kind of has surfaced through the crowdsourcing methodology about what folks, maybe wanted that you didn't expect or didn't want that you, or the reverse of that, right? So like what was sort of an interesting insight that you gleaned from this methodology that maybe you otherwise wouldn't have come to light for you all?
So what I would say is it wasn't necessarily a surprise, but it was the crispness of the insight. And that is how many people captured that their unit is their family, and how critical their peers are in their day-to-day work. And so many rich, positive comments and caring comments about, especially over this past year, as demanding as it has been, about how important strong peers are and the connectedness with their peers and the support that they receive from their peers, which further informed how we can support not just the individuals, but really the teams. And so how do we support them, for example, with listening sessions that are specific to units and teams and keeping them intact so that they can process the experience together.
Terrific. Well, I know we only have a few moments left. I've actually been clicking over to that poll and I see that folks are participating and dumping some great ideas in there in terms of similar things you talked about today, like addressing well-being, employee burnout. So, I encourage you all to continue to engage with that and share your thoughts that way. But I will, if there's no other questions in our chat right now, just want to thank Adam and Russell and Jackie, of course, for being such wonderful co-presenters with us today and sharing the stage. So please, thank you all and have a wonderful afternoon.
Great. Thanks, Rebecca, and thank you all for the opportunity to share our experience.
Thank you, Russell. Thanks, everyone.